Hello. So, I want to talk tonight about conventional labs versus functional labs. And let me get live here on YouTube. 1 second. All right. Okay. So, I had a patient say that I should really talk about this topic. And it is so true because I get so many people asking me about, hey, my labs come back and they look, the doctor says everything looks fine, but I'm still symptomatic. Why is that? Well, it's because the ranges are so wide and they're comparing you to everyone else that's sick that you're not being flagged. And those ranges are just going to get wider and wider as time goes on. So, what I work on is I work on optimal levels. So, I'm narrowing down those ranges and I study patterns. I study for deficiencies, imbalances, um, any type of cancer patterns, disease patterns. That's what I'm looking for. That your labs tell a story. So I so I'm going to open up with this. When I look at labs, I don't just want to know if you're alive. I want to know if you're thriving, right? Like we want to be optimal. And conventional medicine uses population averages, which means as long as you fall within the average sick population, you're stamped normal. But normal does not mean optimal. I'm going to tell you a story. So, Jason doesn't even know I'm talking about this. But I just had a patient a second ago that I just got off a consult with, and he said, how's your husband doing? And he's been on and off with me since, I guess, probably 2020, 2021. And he knew that my husband got really sick during COVID. So when we lived in Mobile, and again, feel free to ask me any questions. I'm on TikTok, YouTube, and Facebook, and I will try to answer your questions as we go. I am keeping this under 30 minutes tonight, so hopefully you won't get too bored. Okay, so he gets COVID, and he's fit, right? He's so fit, and we were the first ones in Orange Beach to get COVID, July 4th, 2020, and he almost dies, literally almost dies, and he got put on the remdesivir in the hospital, and he went into medically induced hepatitis, and his liver almost shut down. Well, every year we would go for our checkups, our annuals. We were diligent about it. I mean, we owned Bodies by Cindy. We were always healthy. So, literally, the nurse would call us, and I'm sure that you get this all the time. The nurse calls you and says, hello, Jason Ross. This is so and so's office. This is the nurse calling. And just want to let you know your labs look fine, and we'll see you again in a year. Well, when I was finishing up my doctorate, I was able to go back and look at all of his labs. 7 years worth. He'd been running fatty liver for 7 years. But because it wasn't flagged outside of their normal range, it was never brought up. And we never asked for copies. I guess we just didn't even know better or think about it. And I know a lot of you are the same because I'm always asking for copies of labs. It matters. Get a copy of your labs, because if you have to be on a drug like remdesivir, that is so hard on the liver, and you're already running fatty liver from supplements or from, and that's usually what I see. I see stone cold alcoholics in my office and their liver enzymes are fine. I see someone that works out every day and their liver enzymes are through the roof because they take too many supplements. And that's what happened with Jason. And so running fatty liver for 7 years, you get thrown in a drug that causes high liver enzymes. Your liver is going to shut down, and your liver is your number one detox pathway, right? So you got to make sure that those liver ducts are working good. Everything's moving, nothing's sludgy, nothing's getting caught, nothing's slowing you down. So just remember, when the doctor calls you and says everything looks fine, you know if something is off. Just listen to your gut and keep digging for answers. Okay, someone can be walking around with inflammation patterns, early blood sugar dysregulation, and even cancer cell activity, yet every single lab marker could still stay within the range. This is one of the reasons why I decided to specialize in cancer, was because I kept seeing these patterns. And that is something that your MDs are, they're not looking at the patterns, they're looking to see if anything is flagged in the conventional labs. So that is why you have to look at the functional ranges, right? So let me define this a little bit more for you. Conventional lab ranges, they're based on the bell curve of the population. They include both healthy and chronically ill people. Wide ranges equal less sensitivity to early disease. Functional ranges is a much more narrow range aimed at optimal health. They reveal trends and patterns long before disease is diagnosable. So I'm able to look and see if there are cancer patterns. 93% of cancer cases are missed when you go to the doctor because they're running CBC, CMP, they're regulated by insurance, and they're not able to get the full story of exactly what's going on. So there are several, like 36 different markers that you can look at to see if there's tumor activity going on in your body. But yet they're never caught when you go for your regular checkup because they're only running the CBC and the CMP. So just remember that there are other markers to see if there's tumor activity going on in the body. So I'm going to give you an example. Conventional fasting glucose, 65 to 99. Functional range is 75 to 86. If I have somebody like today, I had somebody just a second ago that was at 93. It wasn't flagged on the conventional side, but it is on the functional side. That means that you are trending for insulin sensitivity, insulin resistance, and you're not as sensitive as what you need to be to stay out of the insulin resistance range. And what that insulin resistance does is it causes overall body inflammation. It contributes to cancer cells. It is going to make you gain more weight in the midsection. It literally is the culprit. It feeds cholesterol. It is a common denominator. That patient that I just had, he asked me, he said, Cindy, what do you see trending with most people? And that would be one of them is insulin resistance. It is the devil. You do not want to be insulin resistance. If you're holding weight in that midsection, you need to get the insulin resistance under control because it will be a contributor to chronic illness down the road. All right. So a person at 95 blood sugar may be told you're fine, but in functional medicine, it's an early red flag for insulin resistance and cancer metabolism. So just remember that. It's feeding cancer cells. So why this matters for cancer patterns. So I'm gonna share with you how I look at labs through a cancer lens. I look at high sensitivity CRP, which is an inflammation marker, immune system imbalance. I look at abnormalities in iron, LDH, liver enzymes, and glucose. I even pull what's called LD isoenzymes. I don't know if you've ever heard of it, but it literally breaks down the body into 5 fractions, and it lets me know, especially with my cancer patients, it lets me know if there are any areas in the body between blood, skeletal, lung, kidneys, liver. It lets me know what areas there's tumor activity. I would say 99.9% of my patients have never even heard of this marker, nor are their doctors drawing it when they go. Insurance doesn't cover it. It literally costs $10. So it is a very cheap marker. Just to give you, for instance, when you go to the doctor, and even my cancer patients, when they go to the doctor for their labs, they're running the CBC and CMP. Do you guys know how much those tests are? A CBC is $4. CMP is maybe $5. So they're running a $9 test, and they're telling you that everything looks fine. Well, there's a marker called CEA. Some of my cancer patients know it, but a lot of them have never even had it drawn. And they're diagnosed with cancer. They've never had cancer antigen markers drawn. That CEA marker, guess how much it is? It's $10. If they would just include it with their regular checkup when they go to the doctor, and insurance doesn't cover it, it's $10. It would catch 73% of the 94% that's being missed. That's how important it is. All right, so I'm also looking at methylation and detox pathways. The way that you break down things, the way that your gut is able to break down enzymes, all that matters. Like if you've come to me and I said I'm sorry guys, I'm still struggling with this cold, so if you hear me coughing, I apologize. But if you hear me say leaky gut, this all matters. It's all feeding inflammation. It's all feeding cancer cells. It's feeding insulin resistance. Your body is one system. It is not components. We're working it as one system. So when one thing gets off, it throws everything else off. So I always explain cancer as a terrain issue. Your terrain becomes unhealthy. The soil matters more than the seed. So early recognition gives patients power to act before cancer has a chance to grow. I try to educate my patients so when they go to the oncologist, they know what to ask for, because so many times the oncologist is leading the way, and that may not necessarily be the best case scenario for the patient. So my job is to educate you and give you enough lab work to give you that ammo. Sorry. Okay. So I want to talk about some success stories. I had a patient come to me a few months ago. Wasn't feeling good, and doctor said everything looked fine. I decided to run a few cancer markers just in my general wellness, CEA, some cancer antigen markers, end up having some tumor activity, referred them over to an oncologist, and it was a very early stage cancer. So I feel very blessed that we were able to pick up those symptoms and get them the correct diagnosis before it become a full-blown stage, even a stage 2. We don't want a stage 2. We want to catch it as early as possible. A 1A, a stage 1, that's where we want to catch cancer. Remember, cancer is nothing more than a chronic illness. That's the way that we look at it. It's a chronic illness. It is something, if you have a cancer diagnosis, and I just met with someone last week, he said, if I come and work with you, will you give me an all clear? No. You're never clear of cancer. None of us are clear of cancer, okay? I don't care if they tell you get to ring the bell and you just finished chemo and you're clear of cancer. You're never clear of cancer. Let me repeat that. You're never clear of cancer. You always have to be diligent. We all should live like we have stage 4, because we need to live in that prevention mode. Our bodies literally eradicate cancer 9 times in our lifetime without you even knowing it. We're always eradicating cancer cells. That's what our bodies are designed to do. But don't ever think you're clear of cancer. You can never let off that gas. You always have to work on it. You always have to be working like you have stage 4 cancer and work in that prevention mode. We all should live that way. I know that sounds extreme, but we have to live that extreme. If you are 40 and above, you need to be living that way, because that is when things happen. It takes decades for cancer to grow and to show up. So if you get a diagnosis today, that cancer has been growing for decades. It's been there. It has been there at least 10 years. Okay? So just know, if you're in your 40s, you need to be doing everything possible, 40s and beyond. Everything possible you need to be living in. Infrared sauna, you need to be doing cold plunges, you need to be working out, you need to be eating right, you need to make sure that your insulin resistance is under control. All the things. Okay. You definitely don't want to wait until something is broken to care about your labs, right? We don't want to wait until it's a full-blown issue. That is where I come in. I study patterns. I study your blood work to make sure that we catch an issue before it becomes a full-blown disease. That is my job. I go for deeper lab panels. I narrow those functional ranges. I work with your lifestyle, your diet, and supplement strategies to restore balance. We get the terrain nice and healthy. So I want to invite you to connect with me. Hello. Thank you, Kristen. Thanks, guys, for popping on. I really appreciate it. I see you on TikTok as well. I want to invite you to connect with me if you want to dig deeper into this, because I do what's called a functional blood chemistry analysis. There is one of 12 of me in the U.S. that mastered in blood chemistry analysis. I went through a whole fellowship course I did my PhD in health sciences on blood chemistry. I've written courses on it for different universities. I love blood chemistry. When I do a blood chemistry analysis, it's about a 95 page report, and it lets me know any imbalances, deficiencies, everything. I'm able to look at the patterns, and we go through it during our consult. So if you really want to dig deep and see what's going on and get a baseline, connect with me. Go to my website, lifewellnessforever.com. All right, so I have some questions that came through on Facebook this week. So Sarah asked, if my doctor says I'm fine, but I still feel exhausted, could it be my labs? 100%. Fatigue is one of the most common things that I see missed because labs are stamped normal. Functional analysis often shows nutrient deficiencies, blood sugar patterns, or adrenal stress that explains why you don't feel well. Remember, your doctor is not studying patterns. They're only looking for if it's flagged in your conventional labs. And so many times, by the time it's flagged in your conventional labs, you already have a full-blown issue and you're going to be prescribed medication. Mark says, my cholesterol is high, but my doctor just wants to give me a statin. Is there another way? Great question, Mark. Functional ranges let me look at cholesterol in the context of inflammation, liver health, and insulin resistance. Guys, you need cholesterol, okay? I don't really study total cholesterol unless you have a positive lipoprotein A, which we've talked about, that LP little a, which is a genetic lipid marker. It puts you at a 200% risk for cardiac issue, heart attack, or stroke. But a lot of times your HDL, when it's high, I need it high. We want it high because that is where your cognitive function is. Early onset dementia, Alzheimer's comes from a low HDL. A cancer pattern is a low HDL. Hormones are made there. So if you have insulin resistance and you got a low cholesterol, you're sitting in a cancer pattern, which means cancer is gonna grow. And then also it depresses your hormones. So if you're already struggling with hormone imbalance, especially if we're 40 and over, you're already struggling with the hormone imbalance, you got to figure out what your cholesterol is. And so many times you go to the doctor, they check your CBC, lipid panel, CMP, and they say, hey, Sarah, everything looks fine, your cholesterol looks good, your total's fine, but they never tell you what your HDL is. We need your HDL high enough. I like in my cancer patients, I like it between 80 and 100. Most of the times, the common denominator I see with my cancer patients, it's between 30 and 40. Way too low. Way too low. If you're having brain fog, I bet your HDL is too low. Get it checked. Jessica asks, can functional labs really show cancer risk before cancer shows up on a scan? Absolutely. That's why I always like blood work over scans. Labs can reveal terrain patterns like chronic inflammation, altered immune balance, or abnormal iron metabolism. All things that we see in cancer patients years before diagnosis. Remember, we're able to see these things way before the cancer shows up in your blood work. By the time the cancer shows up in your CBC and your CMP, you're usually a stage 4. Just remember that. We do not want it to get that far. So check your labs, and you got to do it on a functional method instead of conventional. That's the only way that you're going to pick it up. David wonders, if my blood sugar is 95, but my doctor says it's normal, should I be worried? Yes, it's a red flag in functional medicine. At 95, you're already trending towards insulin resistance, and that's one of the earliest terrain shifts towards cancer and chronic disease. All right, last question. Lisa says, do I need special labs, or can I use the ones that my doctor's already run? Most of the time, I use the exact same labs, but I interpret them different. Also, I include a lot more biomarkers than what your doctor is able to do because I'm not restricted by insurance. That is one of the reasons I do not take insurance, is because I don't want to be restricted when it comes to your health. I want to be able to look at the full picture. It's the only way to get to the root cause of the issue. All right, guys. So I got invited to be on a very special podcast tonight with Miss Lanice Lagan. I'm sure you guys know her from the TV station. And we're going to be talking about cancer and all the holistic approaches and how it relates to emotional trauma as well. So I got to jet off, and thank you guys for tuning in early tonight. I greatly appreciate you. And we will get back on schedule next week. But if you have any questions, visit my website, lifewellnessforever.com. You can call me at 251-635-7477 or hit me up on social media. This will also be up on recorded as we finish tonight. And I think that's it. I hope you guys have a great night, and I hope this answers a lot of your questions. One last question. Anne Green once said she had a CT scan with dye, and it came back that I have 4 blockages. It was 79 to 99% blocked along with the rest of them. Yep, so I would definitely make sure, Anne, that they're checking your LPA as well. And I would probably research red yeast rice and CoQ10 and your omega fats. Those will get things going your way. And again, thanks guys for tuning in, and I will see you next week.